Hello guys, it's William from Junie Lai and Williams Adventures. And we're coming back to you today with a subject that we thought would be of interest to you that are planning on coming to the Philippines very soon. I've talked to quite a few of our subscribers and they're coming in the next 90 days, quite a few. And we're looking forward to maybe meeting some of you guys. If not, we hope that you will certainly enjoy the Philippines. We're glad that our channel has helped you to maneuver some of the obstacles along the way. Those of you that are coming over to become retired expats and those that are just coming over for vacation. Remember guys, subscribe, give us a thumbs up, and we've recently launched our channel membership. You can join from down into subscription at any level that you would like to join at. There's a lot of perks to joining our team as a member, which you can talk directly to Junie Lai and myself through text at different levels. So check out the perks, guys. We'd be glad to have you join as a channel member and help our team to do the new things that we want to do in the new year, such as giveaways, giving back to the community, helping the community. There's a lot of poverty in the Philippines, and we just like to do our part to give back because we so enjoy living here in the Philippines. But this is our subject today, guys, here at our adventures. We want to talk about health and money. Health and money in the Philippines. A lot of times, a couple of subscribers ask me, quite a few, they say, William, what about health care in the Philippines? Mainly if you're coming over on vacation, guys, you just get traveler's insurance and cover your vacation from the time that you get on the plane to the time that you land back at home. And that's inexpensive. It'll cover you no matter what happens, whether you lost bags, you lost money, you get sick, you get in a motorcycle accident, tricycle accident, whatever the situation may be, it'll cover any situation that you could run into. But for those of you that are planning to do as I have done and to come to the Philippines and retire and live off your pension, your annuity, your Social Security, you name it, whatever your savings, your emergency fund, all these things. One of the things that needs to be discussed in that situation for really is money and health. A lot of guys, the people that have trouble in the Philippines as retired expats are those, one of those things goes wrong. Either they didn't plan their money well, or they didn't take care of their health before. Notice I said before they came to the Philippines. I made sure that when I had decided 3 years before I decided to make a plan, get involved in a long distance relationship online, and then come and meet the person in my long distance relationship, that I made sure of all the health things. I got all the health things done. You remember, guys, Medicare doesn't work in the Philippines. And a lot of guys come here to the Philippines not in great shape, not in great health. They're over 65 or over. And the Philippines is not the greatest place to get your health care done. You can get health care here, but it would behoove you to get your stress test, get your cataract surgery if that's what you need, get your teeth done, or whatever the case may be that you need, even though dental work is cheap here in the Philippines. But you want to get your colonoscopies. Make sure that your health, guys, is in the best shape that it could be before you come to the Philippines. Because remember, you're going to have to pay out of pocket for outpatient unless you get a plan. If you're under 65, healthcare is much cheaper here through any one of the agencies they have here, Pacific Cross, or there's other good ones. And we know a lot of healthcare professionals here that are expats that could help you in those situations. But one thing I did, guys, before I moved to the Philippines, I saved money. I planned. We know that failing to plan is planning to fail. So when we're talking about the two greatest obstacles, I believe, a lot of people think it's your relationship, but it is money and health. Those are the two things that make a disaster happen in the Philippines. Because if you come over here and your heart's not good and you're taking a lot of medication and those kind of things, or you're handicapped some sort of way. Remember, guys, over here in the Philippines, it's not really handicap conducive. The sidewalks are all uneven. It's a lot of places that you go are not handicap accessible like it is in the West, in the U.S. It's different if you're going to come over and you've already made arrangements for that situation. You have somebody that's going to help you, take care of you. There's plenty of caretakers here in the Philippines. But it's best, by a rule of thumb, to make sure of your health, guys, before you decide to make a move to the Philippines. Go get all the battery of tests. At least make sure that you have a clean bill of health before you come. These are things in preparation, guys. Being prepared is to be successful, guys. Make sure that if you're coming on Social Security, that 2 or 3 checks, at least 2 checks, have hit your American bank account before you get on a plane. Make sure of that, guys. If you're getting a pension, you get that in your bank account, because that's going to be coming to you. It's hard to fix it once you're here in the Philippines. They do have a Social Security office. It's in Manila. But you have to make an appointment, and depending on where you're living at, it can be a lot to maneuver to get an appointment, to get there, and then to get into the Social Security office there in the embassy and get things taken care of. Make sure that you have at least 2 Social Security checks, if you're just retiring, hitting your account before you even come. Same with your pension. Make sure that that's taken. You have ongoing money before you would come to the Philippines. Because you need both, guys. You need ongoing money, you need savings, you need emergency fund. We won't talk about budget in this video. We won't talk about how much you need, because everybody's needs, guys, are different. But the two things that usually spell disaster for expats, and we're talking about expats now, are their health goes bad. Remember, the weather's very hot here. If you're not used to a hot, humid climate, the Philippines is that, and it takes adjustment. If you're taking medications, I take blood pressure medicine. Most of those they have here. You can get blood work and those kind of things done here. But it would behoove you to get all the necessary tests on your Medicare, if that's what you're using, in the United States before you come here. Medicare does not work in any of the hospitals here, guys. So you have to get a different sort of health insurance once you get here, if you're going to live here. Or unless you're in a situation where you're going to a doctor, they give you a diagnosis and you have time to get on a plane from here, about 3 hours, and go to Guam. Guam is an American territory, and they do take Medicare. And the other decision that you'll have to make, guys, are you going to keep your Medicare if you're coming here to live? Because remember, they take out a deductible for Part B. And Part B is the area of Medicare where you go to the doctors. If you're not living in America any longer and you have no plans to go back, are you going to keep your Part B? Because remember that with 175, whatever it is for you that they take out for that premium or deductible, that's just less money that you have in your income here. So make sure that you have enough money, guys, because if your health is bad, you're going to need money. And if your money's bad, if your health goes, you don't have the money here to take care of your health. And there's no social services here in the Philippines, guys. So that's what we're talking about here at Junie Lai and Williams Adventures today. We wanted to talk about, to those of our subscribers that are coming over, health and money. Those are the two things. Make sure your health is good before you come. Some guys have come here and they've had heart attacks. Remember, a lot of us that are coming here, you're going to be in a relationship with a girl that's probably half your age. Guys, they got more energy than you, let's face it. Make sure your heart is able to take all the things that your eyes are telling you to do. We're adults here, so we understand that, right, guys? Make sure that you're healthy enough for all the activities that you plan on having. The ambulance system is not good here. If you have a heart attack, you have a stroke, you'll have to get yourself to the hospital. The ambulance is not going to be in time, guys. So that's the two greatest things here. It's not, to me, the relationship. Those are either going to work or not once you meet your LDR. You may end up with a different girl than you've been talking to for the last 6 months or 3 months or a year. That happens all the time, guys. A lot of time, you don't really even need an LDR to come here. You can get on the plane and meet a Filipina here. Guys, there's plenty to meet. So we don't want to take a long time today in this video, but we thought we'd touch on that here at Junie Lai and Williams Adventures. That's something that needs to be addressed, guys. Money and health. Make sure that you have your ongoing budget. I'm quite sure you're coming with savings. I'm quite sure you're coming with some sort of emergency fund if you're coming to live. But remember to have the ongoing money. My suggestion, keep your American bank account. And a lot of guys come over here and use ATMs when that's not a wise way to go. You can send your money to yourself and send your monthly budget to yourself every month on Remitly, Western Union, MoneyGram, any of these. It's a one-time fee to send your monthly budget to yourself, guys. Remember, if you want to join the channel, right down, join as a member, you get access to Junie Lai and myself. We can discuss these things in private. You get a private messenger chat that comes straight to us, that we respond to you. So don't forget, guys, subscribe, give us a thumbs up. And those of you that want to become a team member, a channel member, and help us with some of the things that we want to do into this year, in 2024, go ahead and join. They have different levels to subscribe, join our team as a member. None of them are expensive, guys. But it will help us to continue to push content out and do things in the community. And guys, we hope you appreciate the channel as we appreciate you. But we're going to stop there. If anybody needs to talk, leave a comment. You got any questions, guys, leave a comment. And we'll talk more about this in another video. But that's the two things. From my observations, being here a year and a half, those are the two things that could be a disaster here in the Philippines. There's a lot of good things here, but not enough money and bad health to begin with are two red flags, guys. So get your health together. Take time, get all the tests you got, especially if you're 65 or over, 60 or over, 62 or over. Make sure your money's come in. Make sure your Social Security hit your bank account. At least 2 of those checks if you just retired before you get on the plane. Until then, this is William at Junie Lai and Williams Adventures. And guys, remember, enjoy every day because tomorrow's not promised. And we'll see you next time. All right, guys?